Good day and welcome to Learning Thursdays. I'm Dave Kruder, the Unit Manager for the OASAS Learning and Development Unit, and I'm pleased to be here for today's presentation. Today we are going to return to a discussion of the Community Reinforcement and Family Training model, known as CRAFT, and in just a moment we'll get that started. I'd like to first say that our presenter today is Marcus Doherty, Assistant Director for the Healthcare Reform Consultation Unit of the Center on Addiction, and he's joining us for a follow-up presentation to this program, and I'm excited to have him here. Before we get started, let me just remind folks that Learning Thursdays are offered to addiction professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals in prevention, treatment, and recovery services. Learning Thursdays is intended to support the professional development of the treatment, prevention, and recovery workforce by offering presentations that are relevant to today's behavioral health care profession. As always, if there are any questions, comments, or suggestions, please feel free to write to our Learning Thursdays mailbox. And now, without further ado, I'd like to turn this over and introduce Marcus Doherty again as our presenter on CRAFT. Welcome, Marcus.
Thank you, and thank you for inviting me back for this next part of the CRAFT. I really appreciate it, and again, thank you.
Oh, we're glad to have you.
Okay, so what I would like to do today is to talk about three particular interventions that are used within the CRAFT model. And what I would like to do is to kind of start off with just a brief introduction of what CRAFT is for our audience. And then from there, talk about motivational induction, the happiness scale, and goals of counseling. Okay.
Sounds good.
Okay, so just a couple of preliminary things that are also important in terms of CRAFT. CRAFT was created and developed by Dr. Robert Myers, and also by Jane Ellen Smith as well. So I just want to give credit to where credit is due.
Yeah.
Okay, so what is CRAFT? Okay, CRAFT basically is a model that's intended to work with family members. So family members are actually the focus of CRAFT. And CRAFT teaches them how to care for themselves and how to change interactions with their loved ones so that they seek treatment. So this is an important point, Dave, because very often treatment in terms of families have always or usually been focused on the individual or who we call the identified patient. But the CRAFT model is slightly different because it focuses in on who we term as the concerned significant other, okay, or the loved one of the person that's actually using the substance.
I see. And so that's what the model refers to as the CSO, the concerned significant other?
Yes. And what we'll see shortly is some of the CRAFT terminology so that folks can get familiar with what the terms actually mean.
Oh, good.
Okay. So CRAFT also is about learning about their own behaviors that they may unintentionally be promoting substance use. So this refers to sometimes loved ones or concerned significant others may engage in behaviors that might promote the substance use of their loved one. Mm-hmm. Okay. So CRAFT will help them to learn what those unintentional behaviors are.
I see.
Okay. And also, we want to replace those behaviors with new positive ways to communicate and to solve problems as well. So on the next slide here, we have some terminology in terms of CRAFT speak. So, we have started off by just identifying what CRAFT stands for, which is Community Reinforcement and Family Training. CRA refers to Community Reinforcement Approach. So this was a model from which CRAFT was developed from. Okay, so you may hear this term throughout our discussion today. Okay, CSO, which stands for Concerned Significant Other, and IP, which is the identified patient, or how within the CRAFT model we refer to as the treatment refusing substance user. Mm-hmm. And then engagement is defined as the IP entering treatment. So the goal of CRAFT, as we'll see in a few minutes, is is to eventually get the IP to go into treatment.
I see.
And that's done through the interaction and the techniques that are used by the craft therapist and also by the CSO.
So we're really indirectly targeting the identified patient by offering support to the family member and teaching them how to ultimately help with the engagement of the identified patient. Is that what I'm hearing?
Exactly.
Okay.
And I think the key element is that by changing the behavior of the CSO and also focusing in on their well-being, you're changing the environment in which the IP lives in relationship to the CSO. So if the IP is living at home with the CSO and they're engaged in say, arguments or they're engaged in negative behaviors, by changing the behavior of the CSO, you're changing the environment in which the IP also interacts with the CSO. So by changing the environment, that can be an impetus to get the IP to go into treatment.
I see. You shift their comfortability that they have with the somewhat unsettled or might say dysfunctional environment even that's going on.
Yes.
Good.
Exactly.
Excellent.
So I guess the first thing to talk about is within a craft model, why work with the family? Okay, so we know that people with substance use disorders often report that their family's influence prompted treatment seeking. Now, this really plays into the craft model because we know that family members and significant others have a strong influence on the IP's behavior. So by getting them engaged in the treatment process, they can be a strong influence in getting the IP into treatment.
I see.
Okay. Family members' extensive contact with a substance user is helpful in changing the problem behavior. So this point is important because craft is a model that's very behavioral based. So it works on concepts of positive reinforcement and negative reinforcement. So positive reinforcement is a concept where we want to reinforce positive behaviors. So we do things within positive reinforcement that would more than likely increase that behavior occurring. It could be something like praise. It could be something like a reward. Okay. Negative reinforcement, just quickly, is just the removal of any type of reinforcer when a negative behavior occurs. So those are concepts that we'll talk about a little more as we get into the presentation, but I just want to mention those now.
Okay, it sounds like negative reinforcement in this case is more like the absence of reinforcement rather than any active negative behavior. You just kind of remove the positive and give them no positive reinforcement.
Exactly.
Okay,
so by removing the reinforcement when a negative behavior occurs, we hope to decrease that negative behavior.
Absolutely. Very good.
Okay. And also, early programs with substance users, and this is the community reinforcement approach, found family members to be crucial collaborators in treatment. So again, through this approach is from where craft emerged.
Okay.
Okay, family members also need help themselves, okay, due to interpersonal violence, verbal assaults, financial problems, mental conflict, and lack of support. So very often when concerned significant others and loved ones are engaged with their IP or with their loved one, issues can arise within the family, issues around financial difficulties. If the IP is not working, but the CSO is working to support the family and the IP is not supporting or not contributing to the family, that could be a strain on the CSO. There may be verbal assaults that may happen. There may actually be violence. So these are all situations that impact the concerned significant other.
Yeah.
And very often there's a lack of support for the concerned significant other in terms of working with the IP. So again, craft is really focused on working with the family to assist in those areas.
Yeah. What I like about it is it offers assistance to family and non-using members that are clearly affected by the user's behavior, but often we don't intervene till something more drastic happens. You know, God forbid, domestic violence or some other kind of criminal almost behavior before a family member may sometimes get help. So craft really steps in early in the game, if I'm hearing you correctly, and offers not just safety, but support at the time when it's needed before things might even escalate. So,
Definitely, and I think the beauty of craft is by focusing on the family member, we support them in their efforts to work with their loved one.
absolutely. Very good.
And also one thing that we've also have found too is that historically, in terms of treatment, family members have been excluded from that process. So craft seeks to include concerned significant others within the treatment process as well, which is critical.
Absolutely.
Okay, so how does craft work? Okay, as I mentioned earlier, Dave, craft really focuses in on changing the family environment in such a way that non-using lifestyle behaviors is more rewarding than one focused on the use of alcohol and drugs. So we really want to promote changing behaviors that are positive as defined by non-using activities. So to
Okay.
give you a quick example, if Michael, for example, likes to go out after work and likes to go to the bar and likes to have a few drinks, and he comes home, he's intoxicated, he engages in an argument maybe with his wife or with his mother. So within the craft model, what we will look at is what is the investment in Michael coming home and getting involved in an argument with his loved one. So there's some enforcement of negative behaviors. So within a craft approach, we would work with a loved one around changing that environment. So maybe if Michael's used to that argument, we can work on a communication message that says something else, or maybe help the CSO not to engage in an argument, thereby changing the context. So when Michael comes home intoxicated, he's expecting an argument. But if he comes home and doesn't get an argument, that's a change right there.
Okay.
And then through some additional techniques, for example, helping the CSO to develop a communication message that is clear, to the point, and doesn't engage in back and forth, also changes that environment. So that's just one quick example of how a communication intervention that a CSO is taught can help to change the environment.
So you change what has become somewhat predictable behavior into something not expected by the primary user, and kind of positions them to, at the very least, think a little more or not repeat the same behavior.
Yeah, exactly.
Good.
Exactly. I'm just thinking quickly. Okay, Michael's on his way home. He's probably thinking, "Oh, I'm coming home. I'm gonna have this argument." But then he comes home and there's no argument.
Right.
And Michael might be thinking, "Wow, something's different.
Yeah.
What's going on here?"
Yeah.
So that's an example of how the predictive behavior is no longer predictive.
I see. Very good.
Okay, so craft basically has three major goals. The first is to decrease the IP substance use. The second is to get the IP substance use to enter treatment. And the third one, which I think is really important and one that I tend to focus on a lot, is to increase the CSO's happiness independent of whether the IP enters treatment. Now, Dave, this one is really important because we know that there's lack of support for CSOs. They have increased stress, increased anxiety, increased depression. Their loved ones might have gotten into treatment once before, might have left treatment, come back home. So very often there's this pathway or this spectrum of coming in and out of treatment, but the family member's not really supported. So an important tenet or important goal of craft is to increase the well-being of the CSO, regardless of whether the IP enters treatment. And the thinking is that if the CSO gets stronger emotionally, gets stronger physically, is able to focus back on some things that he or she maybe had to stop doing to care for the IP, that results in a change in the environment, but it also impacts the CSO in a positive, healthy way. And that's also, again, a change in environment that the IP can see, and that could be an impetus to enter treatment.
I think that's a powerful part of the model because often significant others or concerned significant others, as the CSO refers to, often hinge their own happiness or relief or next movement in life on the change in their primary user or their partner who's in trouble with drugs or alcohol, and they unconsciously sit in a holding pattern. So this model kind of gives them the freedom to move forward regardless of the changes or improvement or even lack of in the person that's affecting their life. So that's really an important aspect for counselors to grasp and for patients to experience, very
Yeah,
well.
exactly. And another way to think about it too is that by the CSO focusing on his or her well-being, they're no longer reinforcing negative behavior, because some of my time, some of my attention is going back to me, to focus on me, and it's not engaged in unhealthy behaviors with the IP.
Yeah, that's very good.
Okay, so let's talk a little about some of the craft procedures, and there's some accompanying worksheets that go with these procedures. So the first one I want to talk about, well, before I do that, let me just highlight the three that we're going to talk about today. First one is motivational induction. The next one is the happiness scale. And the third one is the goals of counseling. So Dave, let's go into the first one.
Sure.
So these are the components of motivational induction. And quite simply put, motivational induction is just how do you introduce the craft model or the craft program to a CSO? And these are some of the components. So what we would first like to do is explore the CSO's attempt to stop the substance abuse. So very often this can be a beginning conversation, talking to the CSO about their IP substance history. Have they been in treatment before? How did that work? Was it successful? How did it impact you? So just kind of getting a brief history of the CSO's attempts to help the IP.
I see.
Okay. So from there, we want to talk about how do we start to identify problem areas. So problem areas could be things like, for example, are there financial difficulties in the home, or have there been domestic violence issues? Have there been legal issues? So what are some of the problem areas that the CSO sees? Okay, so you kind of want to get a feel for that.
So you're taking a little bit of history,
Yeah, take it a
kind of
little
getting some
bit.
background.
Yeah, not a lot, because again, we just want to start to develop a rapport connection with the CSO.
I
So we
see.
want to kind of get a feel from where they're at in terms of what are some of the problem areas that they see. Okay. Then from there, we want to talk about, well, we want to introduce craft by describing what the three main goals are. Okay. And just to go back quickly, the three main goals: decrease the IP substance use, get the IP to enter treatment, and increase the CSO's happiness independent of whether the IP enters treatment. So we would want to really talk about those three goals and what those goals mean. And based on where that CSO is at, we can emphasize one of those three. So if the CSO comes in and reports that he or she is really tired of their loved ones using and it's really stressing me out, I really feel depressed, maybe we focus in on the third goal, which is really to focus in on that CSO's happiness and well-being.
Okay.
Or if the CSO comes in and they're really gung-ho to get their loved one into treatment, okay, maybe we might want to use another craft technique that focuses in on how we can help the CSO to move towards that. So it's really, the other component of craft, which is really important, is that it's very person-centered. So we go where that CSO is at.
Okay.
If they want to focus on themselves at first, that's what we do. If they want to focus in on their loved ones, then we'll help to focus in on that area. So it's really driven by what direction the CSO wants to move in.
I see. And as you said, it's really, you're focusing on building relationship at this point as well, right? That's what you're trying to match up with your CSO and the counselor.
Yes, very early on. This is, for example, this could be the first time that you're meeting a CSO.
Oh, okay.
So the first time you're meeting anyone as in traditional classic therapy, there's an introduction. You want to ask the CSO or ask the person, what brings you to see me today, and just kind of get an idea. And then you also develop a rapport. You're using things like empathy. You're being very supportive. You're being very
Okay.
person-centered. And then that helps to build the rapport where you can get some of this information, which is really important.
Okay.
So after you and the CSO identify some problem areas, you want to mention 2 or 3 procedures and how they could apply to the CSO's own situation. So one procedure might be, and I mentioned it in a previous Learning Thursday, was communication skills development. So if the CSO is often engaged in a back and forth with the IP when they come home intoxicated, maybe we can work with the CSO to develop a very short communication message that kind of gets across how they feel with an offer of help, and then extending that, and then just kind of moving from there, as opposed to well, you came in and you're drunk again and you're intoxicated and I can't tolerate this, you need to get a job or get out.
Right.
That's really not effective, and that's reinforcing negative behavior.
I see.
So helping a CSO to develop a clear communication message that's positive changes the environment that the IP expects to engage in when they come home.
I see. So if there's been a cycle of negative reinforcement or a cycle of just repeated unhealthy behavior, just by breaking that sends a strong message to the primary user and frees up the CSO a little bit in their own choices.
Yes, and it also can speak to that CSO's level of stress, because to engage in an argument might be stressful. It can increase their stress. But what we want to do if we're focusing on the CSO is we want them to decrease their stress level, to decrease their anxiety. So maybe one way to do that might be helping them to develop a message or a message style that still gets their point across, but isn't going to increase their anxiety or their stress level.
Okay.
So then you get your message across, but you also don't engage in a situation where your anxiety is increasing.
Very good.
Okay, so we mentioned 2 or 3 procedures in CRAFT. Now, CRAFT has many, but we can talk about things like if the CSO wants to learn how to communicate with the IP in a different way. That's one type of intervention.
I see.
Another one could be, we could talk about the happiness scale, which we'll do today. That could be a second. A third one might be doing what we call a functional analysis. But that's an intervention for another time. But those would be 2 or 3 examples of CRAFT interventions.
So CRAFT comes equipped with a number of tools and a number of instruments that the therapist can use or apply at different stages of the engagement process or the counseling process, it sounds like.
Yes, definitely. And again, it's all driven by where the CSO is at in their process with the therapist and how they would like to proceed. So CRAFT has approximately 11 different interventions that once a therapist gets familiar with them, they're fairly easy to use, and they can be used several times in the process. Okay.
I see.
Okay. So after we talk about 2 or 3 procedures, we could describe how you need the CSO's help. So a large part of the induction in terms of CRAFT is to kind of gauge and to kind of explain the model in such a way where you get the buy-in from the CSO. So the goal is that in talking about CRAFT and its models, there's something in that discussion that kind of grabs at the CSO. So the CSO might say, well, you know what? I really do want to learn how to talk to my son because what I'm saying to him now isn't effective. Mm-hmm. Or, yeah, I do need to focus on myself more. So maybe that happiness scale might be a good thing for us to do. So something within the discussion could grab at the CSO And that could be a direction that the therapist and the CSO can work towards.
Okay, so you're looking for things that motivate the CSO, and then if you have interventions or tools that are well timed to use at that point, you would introduce them.
Yes, definitely. We want to set positive expectations, so we might want to talk a little bit about the craft research. So some of the research speaks to how craft's rate of getting IPs in the treatment is around 65 to 70%. Okay, which compared to other models is really good. Okay.
Yeah.
And we want to talk about confidentiality and safety. So as in any therapeutic process, counselor, therapist working with a client, you set the parameters of confidentiality. So you would have that discussion of basically what we talk about in a session stays confidential, but there's some exceptions to that. You know, one exception could be if the IP appears, if the CSO appears suicidal or homicidal,
Okay.
then you have to break confidentiality, or if there's suspicion of child abuse potentially, and your discussion that comes up. So those would be some of the classic things that you couldn't keep within the therapeutic relationship. You would have to take that outside. So you would definitely want to discuss those and mention those. And then you want to focus on the safety of the CSO. So we don't want the CSO to do anything that will put them at risk. So, and what I mean by that, Dave, is that sometimes the CSO comes into treatment and they're so happy to be in treatment, they just want to go out and they want to confront the IP right away. Okay, because they're motivated, they're ready, they've been inspired. But the craft model is really about skill development. So we want to make sure that anything that the CSO does, that they're trained and they're ready and they're comfortable to do. And then we want to make sure that there's a concept in craft called, we want to inoculate them from failure.
Oh.
Because we know very often that CSOs that have worked with their loved ones before have experienced ups and downs in the treatment process. They work really hard, the IP might go to treatment, the IP might not stay. The CSO feels like a failure. So what we really want to focus on is realizing and helping the CSO to realize that regardless of their best efforts or what they might do, we might have a perfect plan, they have no control over it. What they do have control over is their own well-being. So we may work on a plan for the CSO to approach the IP on. It may be a great plan, it may have been executed well. The IP just might say no. So we want to let the CSO know that if that happens, it's not their fault. They're not a failure. What we focus on is if it didn't work, that's okay. Let's work on something else, or let's look at another direction. So we want to inoculate the CSO against failure, because to feel like a failure adds it to their anxiety and to their depression, or to their feelings of self-worth. And craft is really a positive-based approach where we're always looking at the well-being and the positiveness of the model in respect to the CSO.
I see. It sounds like we want to empower the CSO and not have them encounter something that's going to discourage them unnecessarily, and also help them define what boundaries of safety and boundaries of scope of readiness they are to go forward, and not go too fast so it doesn't backfire or have unexpected consequences for them.
Definitely.
So that's the model does a good job of preparing people to approach that way, I think.
Yes, clearly it does, which is why I really focused in on that third goal, which is really, in my opinion, a critical goal.
And that's the CSO's happiness
and well-being.
And well-being,
Yeah.
right.
Yeah, because just by that alone changes the family environment.
Mm-hmm. Absolutely.
And then that could potentially lead to other positive things.
Absolutely.
Okay, so I talked about motivational induction in a very generic, general way. So now I'd like to focus on it from the perspective of the therapist, or what we call the therapist style. So throughout craft sessions, it's important that we help the client to stay focused and on what he or she wants to work on at that point. So very often clients may come into a session and they may be upset, or they may be venting, or they may be focused on one particular thing, which we know in the counseling process is fine. Clients need to have their space to vent, to express how they feel. But the craft model wants to allow for that, but also wants to keep them focused on what they want to work with. So we always, within the session, get back to what the focus of the session is. You know, we're not going to spend the whole session venting, but we're going to allow for some of that because it's appropriate and it's natural. But we want to keep the client focused on what either intervention they want to work on or what we're driving towards in the session.
I see.
Okay. We want to praise the CSO's efforts to take care of the family. So we want to praise them for the fact that, number one, that they're in treatment. We want to praise the fact that they're still trying to get their loved one into treatment after many attempts. We want to praise the fact that regardless of how they feel in the moment, or if they're feeling anxious or depressed, that they're taking the effort to still get to treatment, to focus on themselves or to focus on getting their loved one in. So it's very inspirational, very motivational, and we want to acknowledge that every step of the way because it's critical for CSO that have been through so much.
Right, and it's not easy for them to step in. Many CSOs have trouble understanding that counseling should be for them when they see the primary user or the identified patient behavior clearly dominating or clearly being the behavior most damaging or dangerous for them and even for others. So I think you're right. It's a good point to spend that time with the CSO.
Yeah, and then the other piece that's really important too, Dave, is the fact that we want to help the CSO to place responsibility where it belongs. So that loved one using is not their fault, it's not their responsibility. But very often CSOs feel that it is their responsibility. Oh, if I would have raised John differently, or if I would have been different in my relationship, so it's my fault that Michael's a user, or it's my fault that he leaves in and out of treatment. So what we want to do in the craft model is that we want to take that responsibility off of the CSO, because very often that leads to guilt, and that leads to depression, to anxiety, to loss of self-esteem, all of those things that decreases the CSO's self-worth.
Don't want to leave room for the blame game, right?
No,
Kinda
we
just,
don't want to play the blame game. And again, I can't say it enough, thinking about that third goal of craft. If we increase the self-esteem, the self-worth for the CSO, you're changing the context of the family environment.
I see.
So important messages for CSOs. One is to help CSOs to understand that what they're going through may feel as if they're alone, but they're not alone in this, in their struggle with their loved one. Okay. They need to take good care of themselves. Okay, because by taking care of themselves, they also take care of their families. Okay. CSOs can successfully learn techniques to engage their loved ones in the treatment. And as I mentioned today, we're going to talk about 2 more of those engagement techniques.
That's right.
Okay. CSOs can live happier, healthy lives whether or not their loved ones enters treatment. And this goes back to the third goal. And craft moves at the pace of the CSO. Now, this is important because there's no time limit in terms of when craft will work. Ultimate goal is to get the IP into treatment, but that may happen in 6 sessions. It may happen in 26 sessions. It all depends on the pace of the CSO and when they're ready to make a treatment invitation. And that can vary. You know, we may need to help the CSO do some work on him or herself first. Right. Before we even get to that point. So the number of sessions are variable based on what the CSO is coming into the process with, or what needs to be worked on.
So it's not a cookie cutter model by any means.
Not at all.
And it sounds like, as you mentioned, these tools are available to help someone move along if need be in the model, or just identify where they are in the process of getting to the point of engagement or approach of the IP, but there's really no pressure intended to be created for that to happen.
Yes, and that's really the beauty of the interventions, because the interventions themselves are varied. So if we want to focus in on the CSO's well-being, a happiness scale, as you see, will be a perfect model. Or if the CSO wants to really work on communication skills to interact with their loved one, then communication skills development would be the approach that would help the CSO to meet that goal. So the interventions are very specific and are designed based on what the CSO wants to do in terms of helping the loved one get into treatment or helping themselves. So that's the beauty of the 11 techniques, is that there's quite a bit of variability based on what the CSO wants to do.
I see. Very good.
Okay. And that the IP's behavior change is a process. It doesn't happen overnight. It can vary anywhere from 3 to 4 months to a year and a half, maybe even longer. So it's a process as opposed to a structured time specific approach.
I see. Okay. It's not measured in time.
No, it's not measured in time. Thank you. So just turning to the components of the happiness scale,
okay.
These are some of the areas that we focus on in the happiness scale, which you'll see in the next slide. But we focus in on the CSO social life, job education, money management, substance use, personal habits, romantic relationships, family relationships, emotional life, communication, spirituality, and general happiness. So this is a scale that we ask the CSO to rate themselves in terms of whether they're completely unhappy or completely happy.
Okay.
Okay.
Or in between somewhat?
Or in between, yes.
Okay.
Yes. And interestingly, a CSO rating themselves in between is really a good place to really start in a lot of ways, and I'll tell you why in a moment.
Sure.
Okay, so this is what the happiness scale would actually look like. So you would see on the top it states happiness scale, and then there's directions here. So you will explain to the CSO, this scale is intended to estimate your current happiness with your life in each of the 10 areas below. Ask yourself the following questions as you rate each area. How happy am I with this area of my life? So you can give the form to the CSO, or you can ask the CSO to rate it either themselves, or you can rate it with them together. And then once they rate the scale in the session, you can ask them, I see that you rate yourself as a 9 in your social life. So it sounds like that's really going well for you, which is great.
Yeah.
Okay. I see that in terms of your job or education, you also rate yourself high. So it seems like things are going well there. So the job is going okay, and it seems that you're happy with where you're at in terms of your education. Okay. I see that in your romantic relationships, I see that you gave yourself a 4. Okay. Okay. So why do you rate yourself a 4 as opposed to a 5? Well, my husband, when he uses, like, we're no longer intimate, we don't go out anymore. I don't feel as close to him. So I use those examples that when the scale is rated, you want to explore those scores with the CSO.
I see.
Now, the key element for this is to focus in on the areas where they rate themselves anywhere from a 4 to a 6 or a 7. And the reason why I focus on those areas is because if you look at a CSO rating themselves a 9 or a 10, there's really not much to work on right there in the moment.
I see.
Because they're completely happy. Now, if they rate themselves a 1 or a 2, they're really unhappy in that area. So it's going to be a longer lift to help them to increase those scores.
Okay.
But if they rate themselves anywhere between a 4 and a 7, it's usually an easier lift to help them to move those scores. So if you focus in on those areas and ask them which areas they want to work on and those areas that they rate themselves between a 4 and a 7, it might be easier to increase those numbers. And if you can help them to increase those numbers, it builds their level of confidence. And by building their confidence, it's easier to help them to move some of the areas where they rate themselves in a 1 or a 2.
Okay.
So you want to work with them in the areas of the 4 to 7s because it's easier to change those areas. It gives them confidence to tackle the more difficult areas.
So if I hear you correctly, it's an instrument that you can use in a counseling session interactively, or have them fill it out and go over in that same meeting, or you could even use it as a homework if you chose to and have them bring it back. Is that correct?
Yes.
So you could do that, and then based on the outcome of the instrument, you can find areas that there is potential for improvement, and they see that potential by defining that as more of a mid-range rather than a high range where satisfaction is great already, or a low range where they may not feel they can make a difference right now. So
Yes, and what you would do is focus in on those areas that they rate themselves between a 4 and a 7,
Okay.
and then ask them what areas would you like to work on. So if they rate themselves between a 4 and a 7 in like 5 areas, you might want to say, okay, let's take 1 or 2
I
and
see.
focus on that.
Focus in a little bit
Yeah,
closer.
and then ask them which ones they would want to work on. Okay, and then from there we can help them to develop some goals around that.
Very
So, for example, if we take, let's take emotional life for example. Let's say the CSO rates themselves a 4 in emotional life, and you say, "Oh, I see you rate yourself a 4. Okay, why did you rate yourself a 4? You know, because I just really seem to be stressed out at home a lot. I'm really, not happy. I'm not doing much. I'm sad all the time. You know, so you may say to the CSO, well, what have you done in the past that really made you happy, or what were the things that you've done, or activities or events that you've done?
Right.
Well, yeah, you know what? Before my husband started using, I really would go out with my girlfriends a lot, and we would really go to movies, or I really would exercise more. So
see.
you may take that and say, oh, so if you got out more, you went to the movies, or if you hung out with your friends more, would that increase your happiness? Would that make you, happier? And then again, that speaks to emotion. So the CSO may say, yeah, so maybe I need to maybe go out once a week, or maybe once every 2 weeks. That sounds like a great idea. Who would you go out with? Well, me and my sister used to hang out a lot, a couple years ago. Would you like to maybe call your sister and work out a time where you or her could maybe meet, maybe have a cup of coffee, maybe go to a movie or go to a restaurant? So in terms of the goal development piece, it's very important to make the goals concrete.
Okay.
So that we can see what it is that they're doing that can lead to a change in the person's emotional base.
So this one instrument can really lead you through identifying where a patient is at or client is at right now in several life areas, and lead you right to a place where you can almost construct for lack of a better term, a treatment plan, or a goal and an objective right up to it, and including an action plan.
Exactly.
The way you're talking. So you have an action-oriented, they can leave with, as you described, something to implement, and not just discussion points. So that keeps it very, very, active-oriented.
Exactly. And if we go to the next slide here, we actually see the goals of counseling form. So some folks may recognize this as part of, or the components of a treatment plan or service plan. Okay. So if you notice on this slide, there's a problem area / goals, and step-by-step strategy to reach the goal, and then there's a time frame. So if we take the example of the person who rates themselves a 4 in emotion, and we talk about that with the CSO, and they say, you know what, it really makes me happy if I can just go have coffee with my sister a couple times a week. The area we identify, or the problem area, or the challenge would be increasing one's emotional state. What would be the strategy or the steps to take to improve a person's emotional state? The step-by-step process may be, Mary will call her sister to arrange to go to dinner or to arrange for lunch. Okay. Time frame. Mary will do that twice within the next week. Okay. So it's identified challenge area. It's a step-by-step process to address it, and then it's a time frame in which it will be addressed by.
So it's very measurable.
So it's very measurable. This form could also be developed within a counseling session as well.
Okay.
If the CSO is not sure how to do the step-by-step strategy, you could practice in the session. Okay, so what if I call my sister up and she doesn't want to go to dinner with me, or she just doesn't want to hang out with me, so doesn't want to have time? That's okay. Is there another person that you would like to hang out with or would like to connect with? So this would be explored within in the session as well. Okay. And part of it is really to help the CSO to really develop a plan, and to also to isolate or to insulate the CSO from failure. So if they call that first person and that person hangs up on them or doesn't want to connect with them, that's okay. What's your backup plan? Let's develop a backup strategy.
Giving them a plan B, huh?
Yes, a plan
Very
B,
good.
a plan C.
Okay.
Yeah. And then their homework is to actually go out and try to implement the goal.
Right.
So now the question becomes, what happens if they have this great plan, they have a backup plan, plan A doesn't work, plan B doesn't work. They come out to the session, neither plan worked. That's okay. Because the goal wasn't necessarily that it would happen. We would have loved for it to happen, but the goal was that you tried it.
I see.
Okay, so we're going to praise you and encourage you for trying the plan or for actually doing it. Okay, because plan A and plan B didn't work in terms of getting two people to go out with you, although important wasn't relevant, the relevant part was that you actually did it.
Right.
So now we go back to the drawing board and we figure out, well, what would you like to try next? Would you want to maybe think of some other people you might want to ask? Or would you want to work on another area in terms of emotion? You know, maybe you want to do something for yourself that would increase your emotion.
So it sounds like you want to make sure you frame this as a success for the client regardless of the actual outcome.
Yes.
They might actually make it to lunch. They may not make it to lunch, but the fact that they're taking the energy and the time and in some cases even the courage to step out of their mold and and make an effort to make an improvement emotionally or socially is something we want to recognize in them. And ultimately, if you can continue them on that path, they will get to a place where even how they measure success, whether it be having that lunch or making it to the movies or meeting up with someone, will ultimately probably come out for them to manifest if you keep them motivated.
Yes, yes, exactly, because it's a change in their current behavior, and it's a change in their behavior with the goal of improving their emotional state.
Very good.
Okay. So just a couple or a few guidelines for goal setting. So when you're working on goals with the CSO, we want to make them brief and uncomplicated.
I see.
So they should be very brief. An example of that would be is, I will call Mary to ask if we can go out. Period. Okay. You might want to specify lunch or dinner, but very clear, very brief.
But simple.
Yes. You want to state in positive terms what the person will do as opposed to what the CSO won't do. So the goal is stated in the terms of the CSO. This is what the CSO will do. Okay. Now the CSO may make that offer, right? But the CSO has no control of what the answer will be. So we always put it in the terms of what the CSO will do. We want to be specific, measurable. Okay. So the goal we just talked about is measurable on like a few different levels. It's measurable in terms of, did Mary make the phone call?
Right.
Okay. It could be measurable in terms of, did Mary go to the specified place where they were going to meet at? Okay, so again, very measurable.
I get it, yeah.
Okay, is it reasonable? Okay, so Mary may not have a lot of money, so it may be reasonable just to go and have coffee as opposed to go to dinner or go to lunch. So the goal should be reasonable. Okay, is it under the CSO's control? Okay, now whether the person shows up is not in the CSO control, but the CSO making the invitation, making the offer, making a phone call, those are things that are under the CSO's control.
Okay.
Okay. And then we want to address any potential barriers.
Right.
So what could be an obstacle to you calling your friend this week?
Well, maybe they don't have the number.
Okay, so is there a way that we can get the number? Or if you don't have the number to your friend, is there someone else whose number you do have that you would like to go out with?
I see.
So we want to discuss those barriers and those obstacles.
Okay. So that when they leave, by the time they leave with their plan, they've already thought through any potential for obstacles or potential failure that could arise that you didn't help them think through. So that leaves them empowered to give it a good genuine try.
Yes.
To be successful.
Yes, and then another important component that should happen is that there should be some practice in the session. So when you call, what will you say to a person? You know, so we will practice that. And there's some craft techniques called role reversal and role play that are also important too.
I see. So the therapist could play the friend,
Yes.
or the therapist could even play the patient or the CSO in a role play and let the CSO play out the role of their friend. So there's a lot of different approaches you could take, ultimately with the goal of equipping your client to feel comfortable and motivated to follow through.
Yes, and a key element is that the CSO needs to develop a level of comfort. And that's done, and that's done through the practice.
Very good. Yes.
So, just in conclusion, Dave, through craft procedures, the goal is to really get unmotivated treatment refusing loved ones engaged in the treatment process, or get them engaged to go into treatment. And to go back to the two goals of craft, to decrease the IP's drug using behavior or drug use, and to get them into treatment, really speaks to how preparing the CSO through their own well-being and through these techniques can really help them to get their loved one into treatment.
I see.
And then, a major theme that I talked about this discussion was getting the CSOs functioning and how that improves regardless of engagement status. So regardless of whether the loved one's into treatment, a major goal is to really focus on the well-being of the CSO, because they traditionally and historically haven't been supported in this whole treatment process with their loved one.
Well, that reminds us how this model really was born in a sense, and it is an evidence-based practice, and it is applied throughout the world, if I'm not mistaken.
Yes.
And it's been replicated and taught to therapists, as I said, internationally. So it's catching on here in New York, and we're glad you're available to bring it to us. We certainly have been afforded the pleasure of looking at certain aspects of the model with your generous appearances here, and this may not be the end of them.
And I definitely hope not. I think craft is a very engaging model, and today we talked about 3 particular interventions within the model. There are several others that I think can be useful, and I tried to choose some ones today that I think were the most engaging. There's some other interventions that hopefully in the future we can discuss that are a little more elaborate, but they're elaborate with a purpose. And as we go forward in these Learning Thursdays, I hope to be able to talk about those as we move forward.
I hope so too, and I hope people will keep their eyes open for opportunities to take training and get some more information other than Learning Thursdays on the craft model. It's certainly out there. There's literature and there has been training available, and we hope to see it continue to be available as well. So I'd like to say thank you to Marcus and really appreciate his coming out and again, sharing your expertise on this model. And we would look forward to the possibility of, again, having that happen again. So we'll talk. But for today, I'd like to again let you know Marcus's contact information will be up on the screen, and you will be able to contact him if you choose. You can always write to our Learning Thursdays mailbox with questions about any presentation or even to a presenter, or even if you're interested in making a presentation. We'd like to hear from you. I'd also like to say that your feedback on Learning Thursdays is important to us, and you'll see on the screen also an opportunity to take a survey and let us receive that feedback, and we look forward to hearing that again. So I'd like to thank everybody, and again, I'd like to thank Marcus and his time that he afforded us, and wish everyone well as we continue to be helpers in our field.
Thank you for inviting me.
Thank you.